Of course, surgery is just the beginning of the recovery process, a process that can be lengthy and very serious with challenges of its own. Within 2 weeks of the rupture, many patients experience two complications from hemorrhage: vasospasm and hydrocephalus. Here's Dr. Christopher Ogilvie.
Vasospasm is the narrowing of the blood vessel. Vaso means blood vessel, and spasm meaning narrowing. Vasospasm typically occurs about 1 week after a brain aneurysm is hemorrhaged. Even when a patient is showing strong signs of recovery, vasospasm can occur, making them feel drowsy, weak, or worse, can cause a stroke. One way to treat vasospasm is a drug therapy that artificially raises the patient's blood pressure. A second treatment method for vasospasm uses the endovascular approach to reach the narrowed blood vessel and then either inject a medicine directly into the artery or perform what is called angioplasty. Angioplasty is a procedure in which a small balloon is inflated inside the artery to expand it. This expansion allows the blood to flow freely once again. The goal of all these procedures is to open up the blood vessel and get more blood to the brain so the patient does not experience a stroke.
About 1/3 of all patients with ruptured aneurysms experience vasospasm, and the first line of defense against this is the medical team's attentive care throughout recovery. The second common complication patients may experience is hydrocephalus. Hydrocephalus literally translates to water on the brain or head. This condition can be very damaging.
Hydrocephalus is the condition of fluid building up around the brain in an area called the ventricles. Our brains are naturally surrounded and protected by a layer of fluid between the brain and the skull. When the brain aneurysm bleeds, blood is introduced into this ventricle area and it has nowhere to go. This increased pressure on the brain often reveals itself in a patient with decreased level of consciousness and could lead to coma if the pressure is not relieved. To treat the hydrocephalus, a neurosurgeon will insert a small, soft tube into the ventricles. This tube, known as a ventriculostomy, provides an outlet for the fluid to drain, relieving the hydrocephalus.
Hydrocephalus comes in two forms: acute, which is very serious and occurs soon after the hemorrhage, and subacute, which occurs later after the hemorrhage. In most cases, hydrocephalus will be diagnosed and treated within 6 weeks of the original surgery.
In certain cases, the hydrocephalus develops into a permanent or chronic condition. This requires a permanent device called a shunt, which is surgically inserted underneath the scalp of the patient. A tube is run from the head to a part of the body, such as the abdomen or a neck vein, that essentially disposes of the excess fluid. The shunt and tube are virtually invisible, and this procedure is highly effective.
Suffering a ruptured aneurysm is a very serious situation. While there is every reason to hope for a healthy ending, there is a very real possibility that a ruptured aneurysm can have heartbreaking results. Experiencing a ruptured aneurysm is extremely challenging for the patient and for the family. After all the medical concerns are addressed, there are still physical changes and emotional difficulties to deal with.
Tremendous advances have been made in the treatment of brain aneurysms, which have greatly increased the likelihood of surviving an aneurysm and the quality of life that follows afterwards. Initially, a rupture victim has an overall 50-50 chance of surviving a subarachnoid hemorrhage. The odds get better after that, thanks in part to the expert treatments that are available today. Of those who survive the initial bleed, 1/3 will recover almost completely, with little sign of the terrible disease they have experienced. 1/3 will recover with lingering physical and neurologic difficulties. These can include impaired memory or cognitive skills. The remaining 1/3 of survivors experiences significant physical or neurologic difficulties.
With most patients, the majority of recovery occurs in the first 2 years. Even after that time, physiological and neurological changes may still be present and are often lifelong. These changes could include speech difficulties. Fatigue is common, as are short-term memory difficulties. As you can imagine, these conditions are very frustrating and draining on the patient, as well as their family and friends. It takes a lot of mutual support and understanding to help everyone through these changes. I encourage patients to participate in available therapies like physical therapy and speech therapy to help them get better. Usually, patients who use these treatments experience a greater rate of success.
Most of these deficits do decrease with time, and patients and family come to feel great satisfaction in the achievements made during the process of recovery.